Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Aboelata from Roots Community Health Center, reporting for the week of January 25th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 70,000 COVID cases and 896 COVID deaths. Here you can see daily case rates. And the good news here is that it appears that we have finally reached the peak of this surge. And it looks like that happened around January 7th. And cases seem to be coming down. But as you can see, we are still much higher than we were in our summertime surge. And we are not out of the woods by any stretch of the imagination. As you can see here, COVID hospitalizations and COVID ICU beds remain high with COVID-19 patients, but leveling off. We hope to continue to see this come down, but they do remain high at this time, and we still have over 400 county residents in the hospital with COVID-19. And again, this is about double what we saw in our summertime surge. I will also start reporting here on total vaccinations during this briefing. We anticipate having county-specific data soon, but in the meantime, I'll report on what we are getting from the CDC. 22.7 million doses have been administered in the United States, and these are both of the mRNA vaccines. And a little over 3.3 million people have already received both doses in the series. Today, I'm going to talk about the workplace, the data that we're seeing at our testing site in East Oakland, as well as some recommendations. And part of the reason we wanted to cover this today is because we anticipate that more people will be getting back to work soon because we now meet the criteria to come out of the regional order that's been in place for several weeks now. And you can find this press release and additional information on the County Public Health Department website. We are now in the purple tier, which is still a restrictive tier, but it does mean that many businesses can reopen with modifications. Now, let's be clear, the lifting in restrictions is not because you are particularly less likely to get COVID-19. It's because there is now enough room for you in the ICU. And that's important, right? If you are one of the 1 in 20 people that gets COVID, who gets very ill and may need to go to the hospital, you want to be reassured that there will be room for you. So the calculations that are done in order to determine that it's okay to begin to open take into account the expected increase in cases that we are most certain will happen, but we are using estimates that our system can handle it. That's good from a population perspective, and as an individual, if you contract COVID, it is reassuring. But this should not be particularly reassuring to you in the sense that it is not necessarily safer out there. By definition, the purple tier we are in means that COVID-19 is widespread, and you remain as much at risk of contracting it as when the regional order was in effect. And that risk will actually likely increase as more people begin to get out and to mix. Looking back at the two most significant reopenings that we have had during this pandemic in Alameda County, those were on June 18th and October 23rd. And as you can see, as anticipated, cases rise in the weeks following those reopenings. Again, these are not surprises, these are predictable, and these risks are being weighed against very real concerns about our economy, among other things. But from an infection perspective, we are starting quite high this time. So I'm glad that the reopening is going slowly, but we should expect to see increases if we don't do a much better job at the basics. Sheltering in as much as you can, masking up, and distancing. If you are exposed or have symptoms, test, isolate, and notify your contacts if you test positive. Now, not only do we expect to see cases start to come up as we begin to reopen, we are also getting reports of a more contagious COVID variant, which has been identified here in the Bay Area. And I'll be talking in more detail about the variants next week. For now, I'll just say that I really hate to think about anything more contagious than this evil virus we've been battling all this time. But that is, in fact, what we are dealing with right at the same time as we are doing some reopening. So now I want to share what we have been seeing at our testing site in East Oakland with regards to those who have tested positive for COVID-19. Just looking at our Oakland testing site, out of the 2,559 individuals who tested positive up through January 20th, the largest number are still catching it in their own home. 37% of cases are coming from within the household. About 21% are coming from the workplace. Now, many of those who contracted it at home are reporting that they live with an essential worker as the most likely source for them as well. So we know that essential work is accounting for at least 21% of our cases, but probably much more than that in terms of them bringing it into the household and being responsible for some of the household spread. Now, out of those getting tested, these are the top 4 sectors that really seem to be doing a good job of getting tested. These are food service and distribution, which is about a third of our folks coming in to get tested. Healthcare, also almost a third. Construction, skilled labor, trade, or other labor at 20%, and warehouse and industrial at 13%. And we want to thank you all for doing your part by getting tested. Now, when we look at who is testing positive at the highest rate, that is how many are positive compared to how many got tested within that sector, you can see here that drivers and package delivery drivers are at almost 69%, retail 50%, transportation and construction and skilled labor come in next at 17 and 16% each. Out of all the sectors, these 4 have the highest positivity rate overall from Roots testing site in Oakland. First, I want to talk about healthcare workers. They represent almost 30% of those tested at Roots, but only 1.4% of those are testing positive. So first, I want to commend healthcare workers for getting tested at a high rate. We know that if we catch COVID, not only are we and our households at risk, but also our patients who depend on us for their health. The low positivity rate appears to have everything to do with workplace protections, proper PPE, and infection control practices that are put in place in the healthcare industry. Remember back in the early days of the pandemic when the United States was caught unprepared at the start and there were shortages of PPE. We lost hundreds of brave healthcare workers on the front lines, especially in the parts of the United States that were being hit the hardest by COVID. Healthcare providers are caring for positive patients, and they're doing procedures like testing for COVID and even procedures that generate aerosols. So in theory, the risk is quite high. So this should be a lesson to us all to say that proper PPE and infection control practices work. And we have our operations and environmental services staff in hospitals and clinics to thank for ensuring that we have appropriate PPE dispatched to our workers and our environments are safe. I only wish that all sectors would take note and consider how to make their own workplaces just as safe. Now, regarding drivers, retail, and transportation, this is where we are seeing the highest positivity rates out of those we have tested. But we're not seeing high enough testing rates. So the first thing I want to say is that if you are dealing routinely with the public, we hope that you will consider being proactive with routine testing. At the very least, if you come down with any symptoms, please isolate yourself. Get tested and isolate until you get your results and further instructions. Based on our assessment of those who tested positive, we are most concerned about a few things. First, many essential workers do not have proper workplace protections. If you are in an industry that requires that you be in an enclosed space with coworkers, but especially with members of the public, you probably need an N95 mask or at least a multi-layer mask. Eyewear is also recommended for several industries and does offer added protection. If you are an employer, I strongly recommend that you invest in proper PPE for your staff and ensure that they are wearing it properly and also properly distancing, and that you have put in place proper ventilation. It's the right thing to do. It protects your staff and your customers, and it will make outbreak management much easier. Why? Because if everyone is wearing proper protective gear and spacing properly, this dramatically reduces the number of close contacts you will have to ask to quarantine in the event that someone becomes positive. And this leads me to the second issue. When outbreaks at workplaces occur, employees are often not notified and the outbreaks are not properly managed. We have heard many stories of people being told that they will lose their jobs if they don't come to work when they try to call in sick or call off in order to isolate because they were exposed. We are very concerned about the number of people being asked to work without proper protection when they should instead be isolating or in quarantine. Again, an N95 mask and eyewear for everyone will greatly reduce the likelihood of transmission. But a major weapon in our fight against COVID is to isolate anyone who is positive and quarantine their contacts. It is very important to nip this in the bud when it happens at your workplace. So if you work in any one of these sectors, really any sector where you work in confined spaces and or you work with the public, you need personal protective equipment, a mask, possibly an N95 mask or at least a multi-layer mask, and preferably eyewear as well. And please don't think that when you get off work, it's okay to take off the PPE and then carpool or hang out with your coworkers without masking and distancing. COVID does not get off at 5. We have heard many cases of outbreaks in the carpool. Just because you're off the clock does not mean you can let your guard down. In fact, on your way to and from work, as well as on your breaks, could be the most dangerous times. Carpooling and riding public transportation both present risk because you are in an enclosed space with others you don't live with. A mask and eyewear the entire ride is your best bet. Don't eat your breakfast, don't drink your coffee, keep your mask on. Break rooms and lunchrooms have also proven to be quite problematic. You may want to consider eating lunch in your car, outside, or anywhere that you can be at least 10 feet away from others, considering that your mask will be off. In fact, Santa Clara County started off 2021 by ordering that employee break rooms can only be accessed to use appliances like the coffee maker or the fridge or the microwave. This is because break rooms have proven to be one of the most common places that COVID transmission occurs in the workplace. Regardless of what county you are in, every employer should come up with a safety plan that includes staggering break times and lunch times and limiting the number of people who can be in any lunchroom space at one time, as well as increasing ventilation as much as possible. Employers should consider creating outdoor spaces for eating, which can even include an overhang and outdoor heaters, or encourage staff to eat lunch in their car. Remember, the best tools we have to fight this pandemic, in addition to the vaccine, are to mask, distance, test, isolate, and contact trace. And this is more true now than ever, As workplaces and other establishments begin to open up, it becomes even more critical that we all remain vigilant. Don't share your air. Shelter indoors as much as you can whenever you can, but only with members of your household. Always protect your elders and those with underlying conditions. If you think you're exposed, don't go to work, don't gather, isolate yourself, get tested in 5 to 8 days. If you have symptoms, get tested right away. Continue to isolate until you get your results, and notify your contacts if you become positive. Take a multivitamin supplement and consider additional vitamin D supplementation. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.